What are your thoughts on sort of this newer generation? I guess it's not even a newer generation of medications. This is stuff that's been around forever, but the psychedelics are now becoming a lot more popular, like treatment resistant depression, going for your ketamine infusion every 3 weeks. Why not throw some mushrooms at it, see what happens? What are your thoughts on this sort of new and evolving facet of psychiatric care?
Have you heard of Timothy Leary?
No?
He was a Harvard professor in the 1960s. Guess what he invented, more or less?
What's that?
LSD, the use of LSD as a way of opening up your mind, of setting aside the cares of the world, of finding a new reality. So these drugs go back many, many years. They're all obviously nominally illegal, but people know how to get them and how to make them. The ketamine thing was, I think, it's good that ketamine came out first for a simple reason, which is that it does seem to work. Uh, Even though it is nominally a hallucinogen, at least at higher dosages, you can get hallucinations with it. Um, it is generally well tolerated, and there's no question that it is a rapid sort of treatment for acute suicidal depression. So much so that there have been studies that indicate that in emergency room settings, where somebody comes in suicidal and you think, oh my God, I got to send this person to the hospital, you can give them an injection of ketamine, and the suicidality can fade away within hours. So that's impressive. Now, as with all things, there are caveats, and the main one is you don't really know the impact in the long term on the natural history of the disorder, as well as on any potential cognitive problems that may arise when a brain is exposed to that kind of stuff on a regular basis. And the so that's a problem. When you get into what's happening today, which is psilocybin, MDMA, and LSD being offered, in microdoses or bigger doses to people with PTSD, post-traumatic stress disorder, or major depressive disorder, it's the Wild West. The research, frankly, has not been very powerful in terms of its efficacy. People who take this stuff know they're taking something powerful. It's almost impossible to do a double-blind study of hallucinogens.
Yeah, yeah, that would not be a subtle
Yeah,
effect.
yeah. So you got to take it with a grain of salt, unfortunately. I mean, again, I go back to the 1960s study, which seemed to indicate that if you took acutely psychotic patients into a hospital setting and you ran their blood through a dialysis machine, their psychosis appeared to fade away to nothing. And so the hypothesis was, of course, we are removing the thing that causes psychosis from the bloodstream when we do dialysis. And then somebody had the clever idea. Well, why don't we just pretend to do dialysis in these patients and run their blood through something which is not a dialysis machine? And unsurprisingly, they all got better too. So the power of that kind of suggestion in this field is remarkable, and it humbles you when you try to figure out, well, my brilliant new idea that I've been giving to all my new patients, they're all getting better. Um, that's just not necessarily true. And I'm not, I'm not saying that that nothing will come of this. I think it's worth studying longer, but it's certainly not ready for clinical prime time.
So cautious optimism. We need more data here. Maybe there's some signal amongst the noise, but yeah, when you
Sure.
look at it from the traditional research approach, it'd be very, very difficult to double blind a ketamine infusion trial. And then what are you actually comparing to?
Well, it's interesting compared to, I mean, that problem is there with regular antidepressants too, because, smart patients can figure it out if they're taking a sugar pill versus something that's causing some kind of side effect. But certain techniques, you take a look at some of these non pharmacologic techniques, say bright light therapy. You can expose someone to a very bright light, which is not enough to treat their depression, but they think they're exposed to a bright light. You can then, do the double blind study and expose the other cohort of patients to an incredibly bright light of 10,000 lumens. And they'll also call that a bright light. And those studies have been done, and they clearly show the superior efficacy of real bright light therapy to even sham bright light therapy, as we would call it. So that can happen. And that's why I'm a fan of bright lights. I'm also a fan of bright lights because it is the most non toxic, albeit somewhat labor intensive, treatment in psychiatry, and certainly the psychiatry of depression. I mean, my patients get sick and tired of hearing me talk about bright lights. But this is the direction I think that we want to go to try to really tease out what works, as well as to be very, humble about the next bright object.